Why do you think that is?
Well, I think that we're removing a bacterial infection that is infecting their whole body. I think that they're feeling healthier because they can now chew better, they can eat better, they have more energy because their body's not trying to fight this bacterial infection in their mouth, in their gums. So they just overall feel healthier.
Nobody wants to lose their teeth. And you're saying that the #1 reason why people lose their teeth is gum disease.
Yes, that's true.
Of the, you mentioned earlier, like 20 million plus denture wearers, upper lower denture, how many of those do you think could still have their teeth if the laser technology was brought in early?
I think the majority of them could
Like
have.
majority, like what,
Yeah.
90%? I mean, this is your
I'd say
opinion.
90%. 90%.
Really? Is that the future of dentistry, by the way?
Absolutely it is. Lasers are here to stay. It's a remarkable, remarkable tool that we now have.
But the future of dentistry, when you go in, you get a cleaning, do you think the future will be you go around the mouth, the hygienist may go around the
In some
mouth?
states, they're doing that now. That's
Really?
not legal in Pennsylvania yet, but the lasers are being used all the time at hygiene visits. Yes, it's definitely the future of dentistry.
And so, final message, somebody, and if we're just tuning in, we're talking about laser dentistry. Give me the symptoms one more time. Okay, so loose teeth.
Loose teeth.
Teeth that are all of a sudden starting to shift for no
Shifting
reason.
teeth, bleeding when brushing or flossing, a bad taste in your mouth. All these are signs of gum disease, receding gum tissue.
So take me through the process. Okay, so somebody watching this, they have those symptoms. The bleeding gums, bad breath, puffy gums. You say they're headed, you don't say it, I'm saying it, they're headed for disaster.
Yes, they are.
Is that right?
Yes.
They're going to lose their teeth?
They're going to lose their teeth ultimately.
Okay, so what does the consult look like? So they go in on day one, what happens? They meet with you?
They would come into the office and we would take some radiographs to be able to see what their teeth look like. So we go around and we take measurements around the tooth. And we know if they have bleeding gums and the probe is going into these pockets.
So you call them pockets?
Yes.
And they have measurements?
Yes, and a pocket is something that it's, at one point the gum tissue should be attached tightly to the tooth.
All right.
And so when they have gum disease and this bacteria is getting into this little space, causing the infection to progress. And as that's progressing, the patient's also losing bone that's supporting the tooth. So by measuring around the tooth, I get a good sense of how severe their disease is.
Now, when you look at it, by the way, do you say this is going to be easy? I mean, do you have those kind of instincts?
Oh, absolutely. And I have a good idea of what teeth we can save and what teeth we can't save. And we can't save all teeth, but we can sure save a lot of them.
Okay, so you look at that. So this is on day one. You sit with the patient, you tell them, okay, this is the game plan.
Well, I give them their options. Of course, I always go through all the options, even the old-fashioned way of treating gum disease.
You give them that option? I
give them that option because they need to know all of their options so that they can make an informed decision.
And how do you say that? I mean, we could either cut it out surgically?
Yeah. We can either cut it out, we can either do the scaling and root planing.
Scaling or root planing is what? You've mentioned that a few
Scaling
times.
and root planing is, you may have heard it called a deep cleaning.
Okay.
It's taking little tiny instruments and going around the tooth to remove the bacteria and
so you're
the
like
buildup
scraping
there.
the teeth?
It's like scraping the teeth.
Okay.
And early on, you can do that if the pockets aren't of any great depth.
Right.
But as the pocketing and the disease advances, you can't just do the scaling and root planing. So you need to either cut out that disease or laser out the disease.
And well, it sounds like everybody would go. I mean, does anybody ever say, hey, I want the surgery?
Obviously
not.
I haven't had anybody want to do traditional surgery since I've had the laser.
But there are thousands of periodontists that are still doing it the old way, treating gum disease by cutting it out rather than lasering it out.
That's correct.
What is their hesitation?
Well, it could be the cost. That could be one factor.
The cost of the laser.
The cost of the laser. Another factor is they like what they're doing and they don't want to learn about the laser.
What do you say to them? Because dentists will watch this show. What do you say to them about
I say that they should do a little research, find out some more information about the laser, and look at the histological evidence showing that we're actually...
So it works?
It works. It works.
How has it changed your job, by the way?
Well, it's made my job a lot easier. It's a lot easier for me to present the laser treatment to a patient than to present traditional surgery to a patient. Patients can sense that I believe in it so much, and I tell them about the results that I have seen. They think that why wouldn't they want to do that?
Okay, so once it's determined you're going to do the laser, then what? then how many times to your office?
2 visits to be treated with the laser, and then there's some post-op visits where I check on them, and then they really just need to maintain their normal hygiene regimen, coming in to see the dental hygienist for cleanings.
So you go around the mouth with the laser, kill the bacteria, and you treat the whole mouth over 2 visits?
Over 2 visits,
Over
yes.
2 visits?
That's correct.
Is it true that, and I've talked to some dentists, they say that the problem with treating gum disease in the past was you would do one side of the mouth with surgery, stitch it up, and the people don't want to come back for the rest of the mouth.
That's right. You actually wouldn't do one side. You do one quarter of the mouth.
So one quadrant.
One quadrant.
Okay.
Exactly. One quadrant at a time.
Is that true though? They don't want to come back because it's so painful?
They don't want to come back. Now they have exposed root surfaces, sensitive teeth, and to hot and cold.
The surgical.
Doing surgical.
So they say,
treatment.
I'm not coming back.
I'm not coming back for this.
So one side of their mouth is done.
And they don't want to come back.
And when you bought this laser, did you call all your people that?
Oh, well, I had one patient in mind that, I treated him, a year prior to this. I did all 4 sides, all 4 quadrants of his mouth. And everything looked great. And in about a year later, the pockets, the disease came back. So I said, you're coming back in. I'm going to retreat you. I treated him with the laser. After I did the first side, he felt so good. When he sat in the chair the next week, he could not wait to get started. He felt incredible. He just could tell.
Did you say somebody was begging you for treatment?
He was the one that was begging me for treatment.
In the green room, I said, I don't know if I believe that.
So
he was actually. What did you say?
He just was like, I can't wait. Let's get started. Let's do it. He's all ready.
So bad breath goes away. The bleeding stops. The teeth get stronger.
Sensitivity goes away.
Hot and cold sensitivity goes away. And what's making it sensitive? I mean, how does the laser? Because a lot of people have hot and cold sensitivity.
Well, the laser's affecting the root surface. So not only is it killing the bacteria, but somehow it's changing the root surface so that the teeth aren't as sensitive to hot and cold.
So in this economy, why do something about your gums? And this is off topic, but I want to hear your take on this.
Well, Randy,
because insurance doesn't cover this.
No. Well, sometimes it does. Sometimes it does.
Parts of it. Okay.
But in this economy, when so many people are out of work, you have people that are going on job interviews. So if they're at a job interview and they're meeting with a future employer and they're smiling and they're being judged by their smile and they have red, puffy gums, they're not, and you have 2 different people interviewing for a job of the same educational background. So who are they going to hire? The one smiling or the one not smiling?
That's a good point.
Yeah.
I mean, obviously, you hire the person that looks happy,
right? That's good.
Motivated,
confident,
things like that. Because you even said to me on the phone, and I didn't quite get that it's more than just gums. Elaborate on that.
Well, it's more than just gums. It's the way that you present yourself. If you're self-conscious about your breath, you're going to stand back and not be who you really are. You're going to be a little bit more intimidated. When you have healthy gums and you don't have bad breath because the disease has been taken care of, you can present yourself in a way that is more presentable.
Okay. Who should get, and by the way, if you're just tuning in, we're talking about laser therapy for people with gum disease. And by the way, do the patients call it periodontal disease or gum disease? Is that the same thing, by the way?
It's the same thing. Most patients call it gum disease.
Okay. And do they know they have gum disease?
Oftentimes not. They don't know. A lot of times in a smoker, it's masked. The redness, the puffiness is not there because the smoke is dehydrating the gum tissues. So a lot of patients don't know that they have gum disease. It's painless. So they don't really know that they have it sometimes until the later stages.
And then they lose their teeth.
And then they can lose their teeth.
And so the downtime, are people missing work over this? Are they complaining about pain the next day? Tell me about that.
Well, there's no downtime. I mean, usually the day of the surgery, I tell my patients to take it easy. I want to pamper them a little bit. They can go back to work the next day, do all the activities that they're used to doing. So there's not really any downtime. There's virtually no pain. Patients are surprised how comfortable they feel the next day after the surgery.
Okay, so knowing what you know now, as a periodontist, could you ever go back to the other way? If they take away your laser, what happens?
I'd be lost. I'd be lost. I'd have to retire.
Really?
Yes.
I mean, if you had to just do surgeries all day, you wouldn't want to do it.
Well, I still love surgeries, but I just know it's not the best thing for the patient. So I couldn't go back.
Now, some guys are busier than others. I've interviewed some other people about gum disease. If people knew, I mean, would you say there's tens of thousands of people in your, maybe not neighborhood, but within 20 minutes
Yeah.
that have bleeding gums, puffy gums, things like that, early stages that would be easy for you to take care of.
Absolutely.
So what do you say to them watching this?
Come to my office, let me take a look, learn about all of your options, and then decide what's going to be best for you.
What are the age ranges of the patients that come in with bleeding gums, gum disease, things
Well,
like
usually
that?
I see patients, baby boomers have a lot of gum disease, but I also see patients in their early 30s, surprisingly, and even older patients who now really want to not only take care of their gums, they're afraid that it's affecting their overall health. So they also want to be treated.
So when you see, I mean, could people have beautiful white teeth and have gum disease?
Yes, absolutely they can. And they won't even know that they have disease, but they'll complain about bleeding. And they'll have these beautiful new veneers, but their gums are bleeding. They have disease. And
so all they have to do is go to your office and you go around, maybe I'm oversimplifying
Yes,
it, but
just
you
a
are
little,
going around the
with
mouth with a laser.
Yes.
And so even if you have veneers, you kill the bacteria.
Oh yeah, absolutely, underneath the gum tissue, certainly.
Now, we haven't even talked about this whole heart disease, diabetes connection. A few seconds on that?
Sure.
What's the connection as you see it?
Well, periodontal disease is a chronic inflammatory disease. So it affects these other, your body's trying to heal this disease. So it's putting your body under more stress. And they also know that the same bacteria that are found in the mouth are also found in the plaques in the arteries.
Okay, great info. And so if they want to find out more, they can visit your website.
Yes, please do.
Learn more there. And your office is located where?
Well, we're
New office, fairly new office.
at the Navy Yard in Philadelphia.
All right. Now, are you from Philadelphia, by the way?
No, I'm from Connecticut.
Okay. And when did you know you wanted to be a dentist? Because you don't look like a dentist to me, by the way, especially a specialist.
Well, I was a dental hygienist for many years in Connecticut, and I just felt like I wanted to do more for my patients. So I ended up coming down to Philadelphia, went to University of Pennsylvania to receive my dental degree.
So you were a hygienist first?
Yes, I was.
How does that make you better as a dentist?
Well,
Or does it?
well, I can't say that it makes me better,
think
but
it
I'm
gives you-
grateful. I'm happy that I have that training because I really focus on the gum tissue and overall periodontal health before taking care of any other aspect of dentistry.
Okay, good. I want to thank you for coming on the show. Very interesting.
All right. Thank you so
it's
much.
a pleasure.
Thank you. My pleasure.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to find out more about the laser or more about Dr. Milici, you could go to our website at wellnesshour.com. Just put in Dr. Milici, or you could put in Philadelphia periodontist, and you'll find her there. Also, for those of you that would like to mention this on Twitter, you can put hashtag The Wellness Hour and make a comment. Say something nice about Dr. Milici. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.